gracias.
Okay, let me get that. Okay. Good afternoon, everyone. Welcome to the April 2024 WRAP Introductory Training on Public Benefits for Refugees. And I'm happy that you could join us. I just wanted to mention a couple of housekeeping items for you. There's going to be some people trickling in as we go. The session is being recorded and will be available on the Better Impact WRAP volunteer portal site and also by email by request. So if you wanted a recording afterward, I can email that. If you're uncomfortable with your likeness appearing during the recording, you can turn off your video. But please stay muted during the training to allow Giovanna to convey the information that she needs to convey. And then there'll be a question and answer period at the end. Giovanna, do you want to take questions as we go, or would you like to do it all at the end?
So what I've learned from previous experience is that I think interaction will lead into more learning for everyone. So as I go, I'll let everyone interrupt me. Don't feel bad.
Okay.
Just raise
Okay,
your
that
hands
sounds
or
good.
raise your hands either with the icon at the bottom or just, I can see you also.
Okay, great, great. Just as a matter of introduction, Giovanna, you haven't met me yet, but I'm Jill Segulin. I'm the executive director for WRAP, and I'll be kind of facilitating in the background for the PowerPoint. And I wanted to introduce everyone to Giovanna Ramirez, community liaison, social services worker. I'm sorry, services social worker from Union County Department of Human Services, Division of Social Services in Elizabeth, New Jersey. Thank you.
Thank you. Okay, thank you for the introduction, Jill. Yes, nice finally meeting you, right?
Yeah.
We were on the phone, yes. So my name is Giovanna Ramirez. I work, I've been doing community liaison for the past 4 years, I would say, but prior to that, I've been, and I also have the role of a social worker on the Emergency Assistance Unit in the Division of Social Services. Mr. Charles Dominguez, he's the assistant administrator. He told me he was going to try to be on the, just listening up, but he's also here today. There you go.
I'm here currently.
Yes.
Yes.
So he's going to be running in and out. So don't mind him. I'll be doing all the talking. um, so like I said, so I'm pretty sure everybody's familiar with the Division of Social Services. If not, and a lot of people call it the Welfare Office. We are the so it's the Department of Human Services in the entire Union County, and then under the Department of Human Services, we're a division. So we are the Division of Social Services. We're the ones who process applications for food stamps, Medicaid, cash assistance, emergency assistance. Um, um, you're gonna have my information at the end of the presentation, and so as Mr. Dominguez. We both work on the unit of community outreach. So in case you guys have any questions, you guys are welcome to either send it through Jill, or you have our emails. You can always send us an email. I ask that an email be sent rather than a call, because usually we're not at our desks most of the time. We're always out in the community or trying to solve cases, problematic cases within the agency. So we're always running up and down, or out in events, especially now that the weather is getting really nice. We're always out there as a face of our division, trying to assist the community in many ways. Okay, so without further ado, Joe, we want to start the presentation, the PowerPoint.
Okay.
There we go. So as I was saying, we are the department. We're part of the Department of Human Services. We're only a division, and our directors are Debbie Ann Anderson. She's our main director, and she has two assistants, Karen Dinsmore and Melissa Lespinasti. In our division, we have two offices because because we kind of cater to all 21 cities of the county. So we have Elizabeth location, which is where I sit most of the time with Mr. Dominguez. And we have the Plainfield location. We also service other cities around that area, pretty much like Rahway, Westfield, Scotch Plain, Fanwood, all those and other nearby cities go to Plainfield for any questions or applications. And in Elizabeth location, we cater more to our surrounding areas, which is Linden. We have here Elizabeth itself. So far and so on. I do have a list that I can provide later on in case you guys come across different questions. That is not attached to the presentation, but I have a list of which offices, which cities are covered by each office. So that I can provide to Jill later on. Maybe she can share it with you all. Okay, but here on the first page, as you see, those are the two addresses, the one in Elizabeth and the one in Plainfield, and they both have different phone numbers. And in each of the offices, we have operators always picking up the calls and answering different questions from the community. Okay, next.
No, is it gonna go? Okay, there we go.
Okay. As mentioned before, so we are the only office, and here what we do is we process or we deal with this assistances, which is the food assistance, SNAP, or food stamps. It used to be called food stamps a while ago. Now they call it SNAP, Supplemental Nutrition Assistance Program. We have the cash assistance, which is in reality, it is cash, but when given to the client, it is not cash that we're giving them. Everything goes or gets loaded up into a card, which is also called EBT card, which looks just like the picture on what it says cash assistance, Family's First card. A lot of people will call it Family First card or EBT card, but that's pretty much what it looks like. We also offer health insurance, which New Jersey Family Care, or a lot of people know it Medicaid. And believe it or not, a lot of people get confused when it comes to Medicaid, because again, under Medicaid, there are many other branches, I would say, because you have what is called New Jersey Family Care for single adults. You have New Jersey Family Care for families. You have New Jersey Family Care for seniors. You have New Jersey Family Care for some type of special programs. Those apply to either undocumented, or they can also apply to college students. So, and everybody calls it New Jersey Family Care, but underneath on New Jersey Family Care, there are others. And I'll get into that as I speak about that subject. We also have a unit that is called Emergency Assistance. And I'm pretty sure you guys have heard about TRA. Everybody wants to apply for TRA. Well, TRA, there's no such a thing as an application for TRA. It is TRA, it's for temporary rental assistance, which we do handle in the office under the emergency assistance unit, but there are many requirements for someone to get that assistance. And I will also dip into that as we talk about that benefit. Next. So the handbook of suggested documents between an organization called UCCYC and us, Division of Social Services, we came together and we created what is called the handbook of suggested documents. Now, where you can find this handbook, I do not put it in my presentation, but I did share with you the link where you can go and get a hold of that handbook. Right now, it's only in English. Now we have it in Spanish. We're gonna try to get it also in Creole, so we can also upload it. But that you can go to www.ucnj.org. Then I did kind of a little path what you have to do. Then you have to visit Human Services, the tab. Then you go to Social Services, and you're gonna find a link where it says Handbook. You want to open it up, and you'll be able to see the actual handbook, and it's a PDF file, where you're gonna see many what we call here verifications. So when somebody comes to apply for any type of benefit, whether it's a SNAP, Medicaid, cash assistance, or emergency assistance, sometimes we request documents, various documents. We can ask for a utility bill. We can ask for a letter from a landlord, a copy of a receipt. We can ask for identification. If you go into this handbook, you're going to find a diverse samples of the documents that we use here in the office. So I always ask, if you're not sure about what a landlord can write in that letter, or when we request a letter, they can visit that link and they can try to open up the page and go to, I think it's like 26 pages, if I'm not mistaken. In one of them, you're going to see a sample of that letter. So it's easier for the person that wants to apply and not sure about how that letter should be written. They can always go and just find the sample and follow that pattern. Next. All right, so we're gonna start by SNAP. Again, remember this used to be food stamps years ago. Even I remember when I first started in the world of social services, I remember we used to give vouchers. It was like a piece of paper, like a little check per se. And that's how food stamps used to be, and a paper, like a paper check. Well, that transition, I think it was almost in the 90s, it transitioned into a SNAP, into an EBT card. So what you see in your screen right there is Family First card. It's an EBT card. Okay, so that EBT card, if the person is approved for either SNAP benefits, for cash assistance, usually those benefits or the amount of those benefits are loaded into that card. Now, just to put it out there, and before we go to the next page, unfortunately, as of last year, there was many clients that got hacked. The benefits got hacked. So I think they're working into making this car a little bit more reliable. I think they're gonna come out with some, I mean, they're gonna keep the same structure of the car, but they're gonna add something to it to make it more reliable because of a hack that happened as of last year. Many clients lost benefits, and unfortunately there had to be like a long process of an investigation to see what happened. And they have found unfortunately a few what do you call it, burglars, I would say, that they were able to get into the benefits of many clients, not just one. I'm talking about like probably over 100 clients that we had. We don't know how it happened, but they just managed. I think it had to be with them using this car in different bodegas, what they call it, little stores around that area, and many benefits were hacked. So pretty sure, I'm sure that
Giovanna,
yes,
I'm sorry. It was actually thousands.
a thousands. Okay, so you see.
Thousands. Yeah, we had 1,000 in February alone. We had close to 1,000 in January. In February, a pair was arrested in New York, operating out of a bodega in Brooklyn. Um, Ever since that release came out, we've noticed it slowing down. March, we had about 600. So we're thinking that they were a large part of this a national kind of operation that's been going on. So we hope that it gets unraveled and maybe by the summer we'll be down to zero again.
Yes, but with that being said,
We got a question there, Yvonne.
yes,
Yeah, I do have a question. We were
yes,
told by a family that they will not be reimbursed for any lost money. Is that true?
They do get reimbursed. The state created a program very quickly last summer because initially, um, you know, if somebody came in and got their benefits lost, we instantly assumed that they gave the benefits away,
Right.
or or they sold the card and the PIN number, and there was no way to get it back. So then the states started investigating and seeing, yes, this person was in Elizabeth, New Jersey, but the benefits were being used in Chicago. So they discovered that this is a bigger thing happening, and they put together some legislation very quick to make it possible for people to get their benefits reinstated. So the state does it 2 times a year. So like if you get your benefits taken 2 times in 1 year, they replace it twice. You know, the client does have to come into the agency to fill out what's called an EBT 20. Basically, that it's a 1 or 2 page form letting us know when they discover the benefits are missing, which benefits were missing. Then they have to either change their PIN or get an entirely new card. Then that goes over to our fraud department. It gets investigated. And once they determine that, yes, this is fraud, they do issue back all the stolen benefits.
How long
Okay,
does it
so we
take?
just, oh, sorry, Jill. We just encourage them then to go in and fill out this form?
Yes.
yes.
That's the best way. I think they do it online, but honestly, the best way is just to come into the agency. It's a pretty quick process. The state, give us, they say 10 days for us to get benefits back, but realistically, it's probably like 2 weeks in February when we had 1,000. It was taken up to 30 days.
Yes.
Yeah, but right now we're in a better space since it's slowing down. We're catching up. So I'd say within 10 days to 2 weeks, they'll get their benefits back.
Correct.
And how long does it take to get a new card if they have to get a whole new card?
If they come to the office, we can get it made for them on the spot. And that's
Great.
something we never really did, but there was such a need for it. Like, we said, listen, let's just give you the card on the spot. We like the mail cards as kind of a way of us to get like address verification also. But if there's a big need, we'll print the card on the spot for them.
Yes. Yeah. And the other thing is when if Ruth, like you mentioned, if something like this is happening to any other family's place, you have to let them know that they have to complete the form that Mr. Dominguez just mentioned, the EBT 20, but that form gets completed either here or our office. It's a 2-page form. But the first thing that they have to do is they have to cancel that they have to cancel the car. If they see that they are, if all of a sudden they were supposed to receive the benefits, let's say the first of the month, and they haven't received it, they can always call the 1-800 number in back of the car and find out if what happened to the benefits. If it says 0 and they think that they're being hacked or the benefit has been stolen, what they have to do is they have to cancel the car right away. Okay. And then once they have canceled the car, then yes, come to our office so they can complete this form. And then they can also request, well, they have to complete another form so they can request a new car.
And one last thing, how far back can it go? Like if they thought, oh, I just lost it and it happened in January, is it too late for them to try and get reimbursement?
Well, what happens is if the person, I mean, usually the people that have come to our office, they haven't waited that long.
Yeah, Yolanda?
Yeah, yes, go ahead, Charlie.
I think they have to discover it within 30 days.
Yes.
That's what I wanted. Okay.
Yes.
Thanks.
Yeah, usually the people that have come is because they haven't received the benefits like last month. They don't wait that long because, they're in need of the food stamps. So they will come right away and say, how come my stamps are not there? And then we try to, we start the investigation right there and then. Yep. So, like I said, I brought that up because of the fact that it's still happening, not as much, and we're still processing, completing these forms for the families that the benefits have been hacked, but also because that new car is going to, I'm pretty sure that they're working on a new car, and hopefully by the summer we'll have something new. Okay, so next. All right, so talking about food stamps. So like I said, it is, a lot of people know it as food stamps, but it is a SNAP. If you look for it anywhere on the website, if you put food stamps, you're going to see a SNAP. It is to help low-income people, families to buy the food that they need for good health. A SNAP are not cash. They are provided into the electronic card, which I just mentioned, the EBT card. It can be used as an ATM or a bank card to buy food at many grocery supermarkets. And now they're also now accepted online. I see like Amazon also accepts that for people to buy food online. For eligibility, we do consider, and this is something that a lot of people ask me, why is it that they get so little? And I explained to them, unfortunately, to be eligible for food stamps, we are going to take the gross income. If a person is working and they get a paycheck, we're not going to take the net, which is pretty much what they take home. We're going to have to go by the gross income. And again, this is per state regulations and rules. It's not us that make up the rules. It's not because I like somebody or I don't like someone that we're going to reduce or increase their benefits. We only request verifications, which is pay stubs or any type of income that the person or family is receiving at the moment for them to be eligible. If a person is working and getting paid every week, we're going to request 4 pay stubs. If a family or a person is working and gets paid every 2 weeks, we're going to request 2 pay stubs. Or if they're getting paid semi-monthly, then still we're going to get 2 pay stubs. If the person is working self-employment cash, then we're going to request, if they have a contractor that they're working for, we're going to request a letter from that employer or whoever is employing them that explains, what kind of business they're in. If it is a solid business, then we're going to need the letter written, a letterhead letter with a signature or information about the business, the I guess the employer's name and address and a telephone number, because we do verification. We will call to verify. If the person works doing side jobs, like a handyman, then they're gonna have to, what we call it, an affidavit. They're gonna have to write their own letter explaining, putting the date and explaining what kind of job they're doing, how much they're making a week. And then we take that as part of a verification. Okay, and that's for people that work, cleaning houses. Sometimes they do babysitting, things like that. Those are the type of letters that we need. And remember, we always call it verification. Anything that we request, we usually call it verifications.
Mhm. How do you handle people that drive for Lyft that may or may not be able to get like a letter signed by a person?
If usually what my understanding is that they get they get deposited into some type of account. They can print that for us, and then we will try to see how we're going to verify it. But usually, if they don't get a letter, I'm pretty sure they get like a statement or something from the bank. So that sometimes when we cannot, or the person cannot provide some type of let's say income verification, we even request income taxes depending on the benefit that they're applying for. We will request for income taxes from previous years. Yeah. Okay. The only deduction, okay, so going back to the food stamps, if the person becomes eligible because of the income, the next thing that we're going to check for how much we're going to issue or how much benefits they're going to get, we're only going to consider the rent, that's the rent expense, how much rent they pay. If they own a house, we will ask for a tax statement. Like, it depends. If they're paying mortgage, we will ask for the mortgage statement or some type of taxes that they pay for their home. And then we do the calculations on our, in-house. The other expense that we will consider is utility expense, but we not necessarily consider utility expense, although we do request the utility bill. It's because they can get some type of credit from LIHEAP or USF. So we usually, especially if they pay for their heat. So that's why a lot of the times we ask them to please provide their utility bills. We will consider child support payments. If the person is paying into their child support, we will consider that as a deduction. And also dependent care payments, if they're paying for some type of dependent care, like we will try to consider that. Now for seniors, what I always have asked them is to please provide us a copy of any medical expense, especially prescriptions, because we can try to kind of use that amount to see if they're eligible for, it will help them with the amount of benefits that they will get. So if I have a senior, sometimes that they're not eligible for Medicaid, that means that they have to pay out of pocket for the prescription. I always ask them, listen, if you can get a copy from X pharmacy, we will try to use that as a kind of a deduction also. And that's only for the food stamps though.
And we have a question from Allie. Yeah.
Yes, Ali, yes.
You have to be off mute.
Sorry. Okay. I want to know if you get like a credit from HHS or you're getting LIHEAP, but it's still not enough, then do you consider the balance or?
No, so we don't really we don't like really get involved with the entire credit. We just ask for the utility bill so we can kind of connect you with let's say with the agency that is going to help you with that credit. But we don't get involved in to see how much you're going to get, if you're going to be eligible. That's really
not in terms of eligibility determination, but like if you have gotten some aid, then that's taken from then the gross as well.
No.
So it sounds like that the utility expenses are not included in the calculation. You just use it to connect.
Right, to connect the person with, someone that might be able to help them with some type of credit towards LIHEAP because of LIHEAP and USF, correct.
Okay, so your gross income, the deductions that would be permissible, rent,
Yes, rent.
Rent.
Child support?
So not utilities then.
No, not utilities, correct.
Okay, so rent and then child support,
Child support payments.
and then child or dependent care payments. How is that calculated? Because say you're spending, something on daycare or something so you can work. If you can provide documentation to that effect, is that then taken out of the gross income as well?
Well, not necessarily. Usually, I believe that the child or dependent care payments, they will consider it up to certain amount, but that's usually made by the unit that is processing the application.
So
I don't have a certain amount of how much, because it really depends on the income.
So it's just in the calculation, but not one for one.
Right, not one for one, correct.
Okay.
Not many people are eligible for the child care. What I do know is the child support payments, they will consider it.
Okay. So the most common deductions then would only be rent.
Rent, correct. And child support payments.
Court ordered payments, but then the rest of the stuff depends on the applicant. Like if you can show whatever you can show is drawn from that gross.
Correct.
Okay. Thank you.
You're welcome. Okay. Next. Okay. So here I'm sharing with you guys the table for that it did increase. For a household of one, the maximum allowable income will be $2,248 a month. For a family of two, the max, a person or a family is allowed to have $3,041. Now, unfortunately, if this goes off by $1, they will be ineligible. Okay. And so this is pretty much the table that it goes by. And so far we've seen families of 5 and 6, usually when there are like other dependents in the household, like the mom stays in there and they're not working. But other than that, as far as I've seen, most common is like 4 and 5. That's it. But this is the table that we use to for food stamps.
Okay.
So ineligibility, unfortunately, people that are not legal, that are undocumented, that do not have a green card, a permanent residency for 5 years or more, are not eligible. And that's why here it says ineligible illegal aliens are not eligible to participate in the New Year's SNAP program, and they refer to visitors, tourists, students, and diplomats, undocumented aliens who have applied for eligible status, who have not yet been approved. We do get many people with a work permit, and unfortunately, they're not eligible. So when it comes to people, we have a new American unit that was created last year. And that unit here within our division, they are in charge of checking, because we have many refugees and asylums. So many of them are eligible, but they go through that unit because they're able to check with immigration through the system to see if they will be eligible for any of our benefits. So when I get questions from the community, well, I have an asylum, or I have a humanitarian visa, or I have a refugee status, I always tell them, when come to the office or do the application online. But the best way right now is to do it online. Try to create the account, try to upload all the documents that you have from immigration, and let us be the ones to determine whether you're eligible or not. And many of them are eligible, and unfortunately some others are not. But at least, they have to come to the source, because we're the ones who are going to verify.
Okay.
Okay. Anybody has more questions about the food stamps? Everyone has a little bit more understanding of food stamps? Oh, thank God. I think I'm doing a good job. Thank you. Okay, so cash assistance. Again, cash assistance, I know that we say cash. Well, it's not really cash that is given to the person. It is a benefit, and it also gets to be uploaded into the EBT card. So that card that we were talking about, that could be hacked. Unfortunately, that carries both benefits. It carries the cash assistance benefit and it carries the food stamps benefit. So the EBT card will carry both. Yes, the person can go and take money out of this card. Yes, they can, because remember, this card can be used as an ATM card. So they can go and they can retrieve cash from it. If it's only food stamps, no, that nobody's going to give you cash for the food stamps. But if you have a cash assistance benefit in this card, then yes, they can give you the cash. Okay. Now, when it comes to cash, the program is called Work First New Jersey General Assistance, or it's called Work First New Jersey TANF, Temporary Assistance for Needy Families. So remember, the Work First New Jersey comes before the GA, and the Work First comes before the TANF. Why? Because this program is established for cash assistance, yes, but also because it intends for the person to go back into the work system. Like, you know, we're gonna give you cash because maybe you're going through a hardship, but eventually you are supposed to be going through a work activity program with this cash assistance, where it's going to enable you or make you go back into the workforce. Okay, so that's why the Work First New Jersey, and you're going to see it in many places where they don't even spell it out because it's so long, but it has the WFNJ GA or the WFNJ TANF, which is TANF. Now, the general assistance is the cash for a single adult or a couple, both adults with no kids. The TANF is the temporary assistance for needy family, and that is for the family. So that when there's always children, the family or the parent, the one parent can apply for TANF. Both parents don't have to be in the household for TANF. It could be one parent and the kids. Now, this benefits of cash assistance do have requirements, mandatory requirements, which I'm going to talk about in the next pages. Just notice another question that I get asked is, if I apply for food stamps, they say, will that, and I'm trying to become legal in the country, right? Will that have some bad impact on my me adjusting the status? And we have told here during all our training that no, food stamps does not do anything when a person wants to adjust their legal status. But in the other instance, cash assistance does. Cash assistance, I guess it is, the government sees it as a burden to the government. The cash assistance will have a bad impact on it. So a lot of the times, I always tell my clients, listen, at the end of the day, we're not immigration, we're not lawyers. So if you really need it and you're going through a hardship and you think you're going to be eligible because of the 5-year permanent resident, you're trying to become a U.S. citizen, or you have a child that is eligible, but you're not, and you're trying to adjust your status, talk to your lawyer. And, I always tell them, talk to your lawyer and listen to your lawyer and do whatever best is for you. Whatever, if you think that you need it now, I mean, regardless, immigration is going to have to understand we all go through hardships, unfortunately, but I always let them make the determination. But I do advise them that as an agency, we have been told that SNAPs and family care or Medicaid does not affect them, but cash will. Because when they receive cash, they are becoming a burden to the government. And then I always tell them, just check with your lawyers if you're on the process of adjusting any type of a status. Okay, so next. Okay, so cash assistance, I explained before, as I stated before, it is for a single adult or a couple with no children. A person to apply for cash assistance should have 0 income. Now, the cash benefit is not, I don't want to say it's a big benefit because it's not, I'll be lying. It's only $185 a month per person. Now, if it is an employable single adult, that's the amount. But if it is a person that cannot work and has submitted a medical form by a doctor and it has been verified and approved, then the person might get $277 a month. Now, if it is a couple that is a person that doesn't have a medical form, it could be $254. And if they have both submitted a medical form, it will be $382 a month. Okay. Now, here comes when I say requirements and mandatory. So a person must comply with a work activity program to receive this benefit. So once a person comes and says, I need to apply for cash assistance because I cannot find employment, I don't have nothing, I want to apply for cash assistance. They take the application, and once they done the application, they will have to comply with what we call a work activity program. A work activity program, it's they get connected with One Stop. We have a different unit, which is the One Stop, and they start kind of in a work search activity. They're going to have to start looking for jobs, trying to see, they connect with another unit where we also have workers, where they can help them see what is it. Maybe they might need to sharpen up certain skills while they're looking for a job. So they have that flexibility of not really looking for a job right away, but at least, trying to see if they need a new skill to get a job. And that's where also like if they need some type of English classes, they might be able to get connected to them. If they want to go back to school, that's why they want to do the work activity program. They have to speak to one of the workers in that unit to see what they can do for them to help them find that job. Now, the work activity, it's mandatory. There is no like, I don't want to do it, because once you say you don't want to do it, you could get sanctioned and then we will deny your case. Okay. In the case that the person or family, the person or the couple that is looking for a cash assistance, for whatever reason, I don't know, they cannot work because there is an impediment of health, something with their health, something to do with their health. The worker will give them a form that is called a Med-1 form or medical form. Now, this couple or person will have to bring that form to the doctor. The doctor will have to complete that form and fax it back to us. That form will be verified by someone in that unit, and then if they are exempt from the work activity, that's the only time that they will not have to comply with the work activity, because they will be exempt, but they have to be that medical form. Now, for all this, there is a process, and it's not going to happen from one day to the next. Like I said, a process always takes time, but at least, we're here for the cash assistance to try to assist the person or couple that needs it.
Mm-hmm.
Um,
I had a couple questions. Yeah, Ruth had a question too. Yeah.
I have another
yes.
question.
Yes,
So, if someone, so we've had people who have been told they need to do the English classes in order, because they've still not finding work. If we have somebody who is not found work yet, and they want to get English classes and they want to get that work activity, is there somebody they reach out to? Because I feel like we would have people who would be doing that if they knew who to ask.
Well, we have the One Stop office on Elizabeth Avenue.
Okay.
So we pretty much work together with them. So there are workers there that they can establish. I don't know. I always say a relationship with them, because they're the same workers always. So they can like try to talk to them and see how they can get assisted on that sense.
So they run the English programs too?
I believe they have different programs that they can help the persons. So yes.
Okay.
So do you have to so you would be referred to One Stop only if you're already getting GA?
Right, you will have to refer,
Okay.
but
So,
on the One Stop, because it's on Elizabeth Avenue, there's also the American Job Center there.
right.
So they're like all together. So for people that are applying for unemployment or are looking for jobs, I always tell them go to that building, because you could get a lot of information. They're on the first floor, and once you walk in, there's people greeting you, and you can ask any questions that you have pertaining jobs, and they'll be able to help you. But if they're doing it through the work activity program from the One Stop, if you go there, you kind of go with a referral from us, so they know what you're going for.
Yeah, and that was my question, that can you go only if you've received a referral? Because otherwise, how are they covering the form? Are they offering it for free to those people who still don't qualify for either TANF or GA?
Well, for GA, TANF is a little different, but yes, for GA, the first worker that interview you for the work activity will give them a referral, because they have to be in compliance. So we kind of communicate. So if, let's say I gave them a referral and they didn't show up, I'm going to get a notice saying he never came. And then we're going to deny the case. We're going to sanction and deny, or deny the cash assistance case. But if we get a notice that, yes, they were there, they established some type of connection, you know, with them, then we're not going to deny a case or sanction, because we know that the client is trying to do what they're supposed to do, and they're probably working with them.
Okay.
I had a couple of more questions. Just to be clear that if it's a couple, both people have to go through work activity.
Correct. If it's a
Right.
couple, yes.
Nobody's going to stay home. And then the other one is if they're caring for, well, this wouldn't do for caring for a young child, because that would be a different.
That would be TANF.
Right? Yeah.
Yes.
Okay. Or
Okay.
if they care for an older adult, is that still TANF? If they care for like a mother or something?
So what has happened is when somebody's caring for an adult or someone that is ill, we're gonna ask them for verification. There is a form. If the person is only a person caring for an adult, then we're gonna ask for the medical form comes into place. We will give them the medical form for them to be completed by that adult's doctor. And there is another form that they can complete and bring verification. They might get exempted, but you know, everything becomes those forms that they have to get completed.
Okay.
Yep.
And I apologize, I have one question.
Yes.
At Legal Services, we used to use a benefits calculator. Is there a way, like, just sort of for the other, to see if you qualify, is there a way you can do it online? Not that it's guaranteed, but there used to be a way to get an idea, get a sense of what you might be entitled to.
You mean for the GA?
Yeah, for GA, but also for SNAP.
I know. So they changed, and I think I know what you're talking about, because I used to do right now is the My NJ Helps.
Right.
Before it used to be, what is it called? Because I even had it before. And I know that when someone did try to do kind of an application through that other website, it will give you like how much would you, an estimate of how much.
Yeah.
Yes. I think that site is still working though. They haven't brought it down completely, even though we're advertising that My NJ Helps. The other one is still working, because I tried it like a couple of weeks ago, because I couldn't find my NJs. I was like, oh my God, I can't remember. And I have it set up on my computer. And I think that it still works. But yes, no, and My NJ Helps, unfortunately, they don't have that.
Okay.
And I don't know if any other will give you kind of an estimate anymore.
Okay. Yeah, that was the most helpful thing when trying to figure out for clients before, because there's so many different limitations. So yeah. Okay. So it doesn't exist anymore.
No.
Okay. All right.
Not on the new link that we are working on, the one that we're working with, the mynjhelps.org. That one doesn't have it. That I know for a fact, because I tried it myself. But the other one, I know the old one, it did. It will give you kind of an estimate how much would you be eligible for, and then you should just go ahead and do the application. I remember that. Yep.
Yeah.
Yep.
I was like, yes, and then I was hoping that you would have it still, and I couldn't find it anymore. So
yes, but I think you can still use it. Do you remember what the link was? Because I know I had it in a previous PowerPoint. I might be able to find it and send it to you and just try it, because I think it's still working.
If you can find it, send it. We just did it through Legal Services, so I don't remember what it was. So it could have been that they were just using their own software, but it did definitely come from like the state of New Jersey. So we were just the legal part of it. So it had to be the same.
Yeah, no, I think that is the same one from before, is the old one. But you know, I guess the state doesn't want us to do applications through that site anymore. But you know, I think in
to get an estimate though, even if it's not guaranteed, just
correct. To do an estimate, I think you could still use it. I mean, I'm gonna try it after I'm done with this. I'm gonna see. Now I'm curious. I'm like,
let us know. It'd be helpful.
Yes. Yep. Definitely.
We good for TANF?
Okay, so before I move on, for my last bullet is U.S. citizens. Unfortunately, for any cash assistance, a person has to be a permanent resident again, 5 years or more, or be a U.S. citizen. In the case of cash assistance, if a person is a permanent resident and not U.S. citizen, they're gonna get 90 days to prove that they're becoming U.S. citizens. Unfortunately, the case will get denied. And when I mean they have to prove, I don't mean that they have to become U.S. citizens within those 90 days, but they have to prove that they are at least submitted an application. Now, whether they become U.S. citizens or not, to be honest, we don't really follow up. We just need to make sure that they are at least trying to become U.S. citizens. So if they submit the application within those 90 days, that's all the proof we need.
Mm-hmm. And then do refugees, are they qualified alien residents?
Yes. So again, so for refugees, asylums, or humanitarian visas, I always tell them again, like I did for food stamps, come and bring us all the immigration documents that you have. The New American Unit, before they even give a notice that says you're eligible, they will run it through the system, which is called SAFE, and they will advise the client whether they're eligible or not.
Okay.
Next, TANF, right? All right, so here we go with TANF, and this is for families. Again, like I said, we call here at the office, we always call it TANF. We don't call that entire name Temporary Assistance for Needy Families. We just know it's Cash for Families. That's it. So again, the Work First New Jersey is for adults with children. The mandatory item for this cash assistance within TANF is that they need to comply with the child support unit. So that means that if there is an absent parent, we're gonna need the information from that absent parent, whether that absent parent is here or in another country. We're still gonna request that information. The only time that we do not enforce the mandatory child support is when there is a DV situation, which is domestic violence, because it gets treated differently. We work hand in hand with YWCA for DV families, but that will be the only instance where the child support, it's reconsider whether it's going to be mandatory or not. Okay, but other than that, if a family does not want to comply, they're going to get denied for cash assistance for family. Yes.
Allie, did you have a question or somebody?
Yeah, somebody say question? Yes, Debbie.
If the other parent is not at all in the picture, whether they're here or elsewhere, how is that handled?
Now that's a good question for child support, but my understanding is as a worker that they need to provide some type of verification. Now, if the parent has been completely absent from day one, I believe they have a form. The child support unit has a form where they need to complete it, and they will go through a different process. But most of the time, to be honest, most of the time the parents has been like, if they're absent because they're in a different country, the parent that is applying for cash assistance will provide information.
Okay.
Thank you.
Any other questions? No. So going on, work activity program. Again, this is set in place for the parents to work towards self-sufficiency. And the same thing, if there is an impediment, a medical impairment, we will give that parent that has a medical impediment a medical form for it to be completed by the doctor, primary doctor, and then be sent back to us. Again, cash assistance, unfortunately, has to be 0 in the family that is applying for cash assistance. And as far as the legal status, the family has to be either a qualified alien resident or U.S. citizen. And again, it goes back to refugees, asylum or parolees or humanitarian visas. I always tell them just, do the application and let us be the one to determine after we do the search in the system with SAFE immigration, whether they're going to be eligible or not.
Mm-hmm.
But at all times, the difference between cash assistance for families and the cash assistance for a one person or a couple is the mandatory child support. that is definitely a mandatory child support for everybody.
And now I had a couple of questions about
Yes.
Yes. First, since the family must not have any sources of income, once they start working, even if it's a tiny bit, part-time, something like that, that they can't do their rent and that kind of thing, are their benefits cut then at that point or reduced?
So the benefits start by reducing it, but they're not, okay. So what I know as a worker is that once a family has no income whatsoever, and then they establish a work activity program and they start working little by little, after the first month of permanent employment, not necessarily temporary or full-time, but permanent employment, they're supposed to let us know. So that way we can, we know that they're working on a best way to get self-sufficient. And then they start reducing either the cash assistance that we're giving them little by little. Now, with the cash assistance, what comes is the child care. Now, with the child care is like if the family, both parents or one of the parents starts working, they can always apply for child care through us. And that will last, I believe it's up to a year. If they come to us and they let us know, kind of give us information whether they found employment and they making this much and that much. The cash assistance is not gonna get cut off right away because the cash assistance for a family is higher than the cash assistance for single adults or the couple of adults is a little higher than that.
And then my other question is are there any exemptions for like the caring for older adults, for caring for a young child?
So it really, I believe they have, so in the TANF unit, we have a work activity worker for the TANF itself, and they will have to work with those workers again to set up some type of childcare. So we work with 4Cs. So depending on the age of the child, we might connect the family to 4Cs to see if they can get some type of daycare for the child while the parent is going to work.
And how long does 4Cs have to get established? Like if they have to start working and they don't have childcare right away, where's the stopgap for that?
So 4Cs also has its own requisites, and they also have some exemptions to those rules. So the person will need to work not just with us, the Work First New Jersey program, but also with 4Cs to see, because I've seen many families that start working full time and they still get 4Cs involved until, they can completely be of their program as well. What are the requisites for them? I'm not sure, but I can always share information to you. 4Cs, they're also called UCCYC. So they are on the same program. And, that's information that you might want to get from. They have different programs on the child care, which makes many parents eligible, but they work with us because of the TANF benefit.
Okay.
Yes, Debbie.
If a parent cannot work full time, can they meet the requirements by working part-time?
You mean for TANF?
Yes.
Well, remember, yes, they can, but remember that the whole cash assistance program is pretty much to help them become self-sufficient. So, I mean, I hate to be realistic, but you have to think like, okay, so if you're going to work part-time, are you really going to be able to support yourself and your child's needs and your rent? So, I mean, yes, a parent can still be eligible depending on how much money they're making with their part-time, but that's not going to help them to become self-sufficient.
In the case of they're caring for a child with major disabilities, which they cannot use, a care center for.
Okay. So
does that put them in a different category?
Yes, it does. So they have forms again where they can have the doctor complete and send it to us that can exempt them from the work activity itself. But then at that time, we also recommend that if the child has a disability, a permanent disability, we're going to try to connect them with legal services so they can apply for SSI for that child.
Right.
And that will be counted as another source of income. I mean,
Right, right.
an SSI, you know, we cannot, if a person is receiving SSI, then they're not eligible for cash assistance, but they're still eligible for food stamps. And on that instance, the SSI is not counted for food stamps.
Okay.
Okay, thank you.
Mhm. Any other questions? No? Okay. For both cash assistance benefits, there is a lifetime limit. And here comes maybe part of answering to Debbie, because there is a lifetime limit to all cash assistance. So you can only do part-time. If you're taking care of someone, you can I mean, you have to think like 5 years is all you're gonna get in cash assistance. There are extensions to every rule though, okay? But it's still 60 months or 5 years is what pretty much the time limit for cash assistance benefit. And you know, when you have a permanent disability, unfortunately, it's gonna need more than 5 years. So that's why I always, me personally, when I, as a social worker here, I always try to understand every case that comes through the door. And I know, and I start by telling everybody, I'm sorry, I need to be honest and cruel and real, but you know, this is how much time you have, and you have to use whatever, all this time to think whether this government benefit is not going to be there for you for your life, throughout your life. So you need to think of other ways. So I'm like, if you really think that you're disabled, then you need to apply for Social Security
SSDI.
benefits. Right. I'm sorry?
Would you do SSDI? Like if you
Right, SSDI, correct. They have to do RSDI. If you know, but in reality is I always tell them, take advantage of social services in the sense that if you're going through a hardship because you lost a job today and you think you need a new skill, or you want to be better in a certain skill, I don't know, then try to apply for cash assistance, apply for food stamps, apply for Medicaid, but use this benefit wisely. You know, go to school during this time, try to do what you have to do. So once your 5 years come and you have used it all, then at least you came out with a new set of skills that is going to help you get another job. And I know that, I mean, I always say this is my real, to me, it's like, oh my God, this is like a, not real, but I'm like, you know, I always tell them, especially when I see people that are young, I always tell them, you know what, I'm not saying use the benefit, but try to use it wisely. Get the cash assistance, get the food stamps, get everything that you can from us, but, you know, go to school or go somewhere and get a new skill, you know, sharpen up those skills that you think you're best at.
Are
And
there
then once the 5 year counts, that's it, you're out. You don't have to worry about more social services.
are
Yes,
there
Jill.
resources or money for going to school program or get certification or something?
Well, that's why one stop.
One
That's
step.
why they have to go through one step, correct.
Okay.
And the American Job Center, believe it or not, American Job Center has many programs where persons can go and try to apply for different certifications because they're helping them. Nowadays, there's different organizations like New Jersey Reentry. They also are given, they also help people with getting some certifications like in high-low, construction, things like that. People, if they don't want to go to college per se, they can, you know, just try to get a certification in certain skills. There are programs out there that are free, but unfortunately, yes, you got to do the
Mr.
search. You
Mears,
have
would
to
you
look
mind
for it.
Sorry, Mr. Mears, would you mind repeating the names of the other programs, like the certification program?
New Jersey Reentry,
Okay.
which a lot of people think is only for people that are just that were
Yeah.
incarcerated and being
Yeah.
released. No, it's not. They're
Okay.
out there because I have called myself to find out, and they told me a lot of the time, no, it's for anyone that wants to get certain certification. They can help you around.
Okay.
Okay.
And then
There were a couple others. There were like a couple others that we knew about at Legal Services, but I can't remember them right now. And I want to know if there was like New Jersey Reentry.
Yes, that's
New
one of
Jersey
them.
Job Connect or something like that.
Yes, so it's the American Job Center.
Okay, that's the same thing.
Yes.
Okay.
American Job Center. Yes.
And then this 5 years, is that from state to state? So if they move to a different state, does that reset their 5 years or no?
Oh, that's a good question. You got me there, Jill.
Okay. My understanding is that it does not reset, but
No, I
because
believe
it's a
not.
federally program.
Yes. So at the end of the day, even though we call it's only in New Jersey, no, it does. We communicate with other states. thing is that it will be hard for us to find out if a person is getting benefits, let's say from, I don't know, Chicago, and they use all their 5 years. And if they come here, sometimes we try to establish communication with other states, but it gets to be very hard. Now,
Okay.
the only thing that we do is whether if it is in state, that's a little easier for us to find out whether they used it in a different county, because we will count it. So if they use the cash assistance in, I don't know, Essex County, we can still see it in our system because it's a national system, it's New Jersey. But if it's out of state, it's going to be hard for us to see that a person used it and exhausted it.
Okay.
I had like one last question and then I'm done because I actually have to log off. Sorry, but I want to ask, like, for a permanently disabled child, what benefits are there out there?
Through our agency,
Yeah.
it will be food stamps.
Okay.
For
So,
the parents will have to apply for the food stamps.
okay. So you would just get SNAP and then
Yes.
you would probably refer them to like RSDI?
Yes. So if the child is not getting SSI, because remember, a child probably will not eligible for Social Security benefits, but only SSI because the child does not have the credit. So yes, we will refer them to legal services, which I believe you, right? And then try to, you will have to, you guys in legal services work with the child to get or the parent to get the child the SSI.
Okay. But that's it though.
That's it. Yes, unfortunately, because once they establish the SSI, they get the Medicaid from the state, which is a different Medicaid. It's a state Medicaid.
Okay.
So they wouldn't have to worry about the health insurance. And then the cash assistance, they wouldn't be eligible because they already are getting SSI, which is a bigger benefit than the one we give.
Okay. And the other last question I had was about EA.
Emergency assistance, yes.
Yeah. So if a family, it's like sometimes we get families and even before they can apply to benefits, or if there's a lag sometimes and they need to meet rent or something. What's the, like, how do you apply for that benefit? And is it a one-time benefit? I don't know anything about emergency assistance, so I wanted to
That's
ask.
actually going to be later in the presentation. So
Oh,
Alex, I don't
sorry.
know if you wanted to check out the video afterward or.
Okay, sorry.
I think it's coming up real quick, so I don't know
Yeah,
how.
we're just going to do,
Yes, because I pretty much cover everything here on this slide. The work activity, it's like I said, have to go through one step. The initial interviews, employment specialists, that's what I said, they have to meet with someone at the one step. And if the worker feels that the person has a substance abuse or a mental health, they're going to give them a medical form or refer them to NCADD, which is another unit that works with us to complete that form and kind of make that person attend some type of assessment so they can continue some type of treatments. Clients who become active GA TANF recipients will be receiving Medicaid. Yes, and again, we go back to the training. Once a person is receiving cash, we will be able to help them with the child care, which we connect them with 4Cs. Sometimes if we see that the person is making efforts to become self-sufficient and looking for jobs, we can help them with transportation, or we can help them with some type of work-related expenses like for uniforms. Again, there is persons that have disability for over 12 months and provide our office with the proper medical forms, which we're talking about Med 1. They will be referred to legal services to apply for RSDI or SSI. Okay, so that we talked among all the questions that I responded to. Next.
Okay.
And I just put in here, Social Security Administration. Remember, we do not handle any of these benefits. I put it here so you guys can have it on the power slide because these are the different benefits under Social Security Administration. That is a federal benefit that we do not take an application. We pretty much have nothing to do with all these benefits. They come from the federal government.
But you work in tandem with the Social Security Administration.
Exactly, in the sense that we need to referrals, right? If somebody is disabled, we would tell them, okay, you have to either apply or go through legal services to apply for one of these benefits.
And
Yes.
this SSI counts as income for if they're applying for TANF.
Not for TANF, but for food stamps.
For food
Depending on who gets the SSI though. If it is a child, if it is a TANF, a family where there is a person applying for SSI, a person receiving the SSI, they can apply for those that do not receive it, and the SSI will not be counted. But if it is food stamps, I'm sorry, I'm saying it the other way. For food stamps, we will not count it, but for cash assistance, we will.
Okay.
I'm sorry, Giovanna.
Yes, Charles. You want to correct me on something?
SSI doesn't count for TANF.
Okay, I'm sorry.
Yes.
Okay.
So say there's two parents and one child who's SSI. The parents can receive the TANF benefit and the child does not get any extra cash because they're getting SSI. But for food stamps, the SSI money does count against SNAP.
Okay, so it does. It was the other way then.
Yes.
I was right at the beginning. Sorry.
I know it's confusing. Trust me.
Yes. So did you hear that, Jill?
Yeah.
Can you repeat it one more time? Sorry.
SSI money does not count against a TANF grant. So, you can have 5 children getting SSI, getting $3,000 a month in SSI benefits. And the 2 parents who are not SSI recipients can apply for TANF and still get the benefit. Every other Social Security RSDI, that counts against a TANF grant, dollar for dollar.
Okay.
And it does count against SNAP.
Yes. Yes. Everything
Yes.
counts against SNAP.
Right. Okay.
Okay.
Mm-hmm.
Got it. We move on real quick. So health insurance. Again, as I was saying, New Jersey Family Care, a lot of people call it Medicaid. Everybody says Medicaid, 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 and this is the popular Medicaid. It is New Jersey Family Care. It is publicly funded health insurance program. It includes the CHIP, the Medicaid, and Medicaid expansion populations. That means that qualified New Jersey resident of any age might be eligible for free, low-cost health care coverage that covers doctor visits, prescriptions, vision, dental care, mental health, and substance use services, and even hospitalizations. And if you are a New Jersey resident and you need more information, all you have to do is go to the website and you can do the application online. Individuals ineligible for New Jersey Family Care can also find information on other insurance affordability towards they get covered New Jersey. So people that are not eligible for family care Medicaid, they can always still get a state, some type of a state Medicaid, but everybody calls it Medicaid, but it's really health insurance, but they will have to go through get covered New Jersey. Okay, and I provided you guys both links when they want to apply for it. Next.
And both of these work for New Jersey Family Care?
So New Jersey Family Care, yes, because that's my NJ Health. So Get Covered New Jersey is not really family care, but people still call it Medicaid. Or I heard people also call it Obamacare, which, into the Get Covered New Jersey is pretty much for those that are not eligible for New Jersey Family Care.
Okay.
Yes. Eligibility depends on the gross income and household size. So here there is no adjustments. They're gonna count again, gross income dollar per dollar. And here it really depends on the size of the family. So if there is a family of 5, they're gonna consider the entire income of the family and then put it into our table and figure out if they're gonna be eligible or not. New Jersey Family Care is health insurance for families and also for adults with dependent children. Under the Affordable Care Act, Medicaid adults between 19 and 64 years of age could be eligible, including single or married couples with no dependent children. Employment authorized and undocumented persons are not eligible, but I'm going to get to that because that there is an exception to the rule, which I'm going to talk about in a minute. Adults that have 5 years of being a legal permanent resident are eligible. A permanent resident child under 19 years of age could be eligible. The 5 years permanent resident does not apply. A pregnant woman that does not have 5 years of legal permanent residence and is an undocumented woman are not eligible for Medicaid, but labor and delivery can be covered under a special program. So that's a certain special Medicaid. Okay. Next, I want to see if I. Okay, so ABD Medicaid. Again, we go back to the word Medicaid. That's why a lot of people get confused. So for adults that are blind, disabled, there is the Medicaid. They call it ABD Medicaid, which stands for Age Blind and Disabled Medicaid. And I call this the Senior Medicaid, or Medicaid for, seniors. That's what it's called. And the site where someone can apply for the ABD, it's there. Also, I provided the link. Once any of the applications for family care or Medicaid is received, our agency worker will try to make a contact with the client to start the process. And that goes on regards to any of the family cares. Next. Okay, so this is what happened. So as of January 1st, 2023, for someone to apply for family care, even children, they had to have the 5-year permanent residence. As of January 1st, 2023, that changed. Children that are 19 years of age and under, they can apply for family care even if they don't have the legal status. But that only applies to children that are 19 or under, not their parents, only children. That's the only thing that changed. I mean, the application pretty much, they will have to provide information. It asks a lot of more information about when you got into the country, how is it that, do you have a number, a social security number? And at this point, it's just for reference, because it really doesn't matter whether the child has a social security number or not. The children can apply. Now, mind is that we will still consider the family gross income. Okay, but it really doesn't matter whether the child has a legal status or not. That's the only thing that changed. Okay. Okay, so before I move on, again, just going back to Medicaid, like I said, under the Medicaid program, which everybody calls a Medicaid, I just talked about the ABD Medicaid, which is the Medicaid for senior adults, where they have the MLTSS. They have, a lot of people have been asking me about home health aid. All those benefits are under the ABD Medicaid. Now, they do request 5 years of income statements, bank statements. They have to have pretty much under $2,000 resources. And that's I'm only just mentioning this about the senior Medicaid, which is the ABD Medicaid. For the other Medicaid, which is family care for single adults, you have to be very low income to qualify for that Medicaid. Sometimes they even ask you for your income taxes from previous years to see whether you're going to be eligible for that Medicaid. If you're a single adult or a couple of adults, they're going to request a verification of any type of income. The family care is more like for the family when there is children, where they're still going to check the income of the entire family to see if there is eligibility for the child and the parents. And like I said, if by any chance the parents' income is above the limit, then they will refer them to Get Covered New Jersey. Now, just so, and because I worked as an ambassador a couple years ago for Get Covered New Jersey, I can tell you that people that have a Social Security card and are in the process of becoming a permanent resident, they can apply for Get Covered New Jersey. The organization that I know that works with them a lot is New Jersey Citizen Action. Is one of the organizations that helps them with the Get Covered New Jersey. They also have, I believe, Hopes in Plainfield is another organization that helps with the application. But the one that I know the most is New Jersey Citizen Action, because I was an ambassador for them. They do the applications online. You can call them, the client can call. And what they do is they help them with the application, and they help them locate programs that can help them with the cost of the health insurance. So that's one of them. And that's for Get Covered New Jersey.
Okay. Before we move on, I just wanted to note something. When people were talking about children with disabilities, that New Jersey has an early intervention system for children from birth to 36 months to 3 years. And the children could qualify for special programs and medical programs and whatnot. So I just wanted to, just mention that. And then, of course, from age 3, if they require special education, then it would be the Board of Education in the district where they live that would be able to support them with programs and educational programs to meet their needs.
Yes, thank you, Susan. You're correct. That early intervention, it can either, you can reach out for more information on that also to prenatal partnership. What is it called? Maternal. The name is coming to me, but it's a prenatal. There is an organization for prenatal partnerships, maternal something. I have the information. I can also forward it to you guys. But yes, they can. There are programs through them for prenatal and with early intervention, like Susan mentioned.
But the New Jersey Early Intervention System is on the new nj.gov page.
Okay.
There's just a phone number and lots of information. Babies and toddlers can't wait because kids, it says, who are not meeting milestones or have, you know, evidence of issues, the earlier they get help, the, you know, the better off that they'll be. So the website, and there's a toll-free phone number. So it's, at least you know, it'd be a very good place to go to first.
Yes.
Mm-hmm. And that now for kids over 3 and to refer to the school district, that's regardless of the severity of the disability. Is that correct?
Well, you know, there's a process to classify kids, whether to see whether or not they would get services. But the districts, that's a federal law. They're responsible from age 3 on, and there's a, you know, a whole eligibility, a lengthy kind of a deep process. But
thank you.
Yeah,
it is a good program. I tried it. I found the flyer and I referred someone to it. And now the child, I think he's about to be 3. And now, like Susan said, now the child is getting referred to the school district in Elizabeth. But before that, when she made the contact, I think the child was 2. And yes, the child was getting, I mean, yes, you're right, Susan. They do provide, and even though there's a lot of calling and a process, I mean, you know, the parent will have to do the work there. But yes, there is a lot of assistance through that 800 number. Yep.
What is the amount of the benefit for EA?
There is no set amount, unfortunately. And the emergency assistance benefit is not such a thing as an amount. So emergency assistance, it's we work with vouchers. We do more like trying to help people become homeless. So we're not gonna have like a set amount of how much assistance we're gonna provide. There's no set amount. So I'm gonna go into that right now. So emergency assistance, in order for a person to be or to see a social worker or receive some type of emergency assistance program, the person needs to be receiving cash assistance from our office or be an SSI recipient. Like I put in there, persons can include those who are homeless, are at immediate risk of becoming homeless, and those who have experienced a substantial loss of housing, food, clothing, or household furnishings due to fire, flood, or similar disaster. Now have this in mind, emergency assistance is only good 12 months throughout their life. However, extensions can be granted depending on certain conditions and certain limitations. Next. Okay, so emergency assistance pretty much is to help prevent homelessness. Emergency assistance can include, but it's not limited to, essential food, clothing, shelter, household furnishings, temporary rental assistance, or back rent or mortgage payments, utility payments such as heat, water, electric, transportation to search for housing, and moving expenses. Also storage. Clients could be eligible for emergency assistance when their case of cash assistance is open, or if they or someone in their household is receiving SSI or a combination of SSI and SSD. The person must be able to show that they're about to lose their utility services. We will request verifications as a short of notice. Must show verification that they're about to be evicted or facing foreclosure or eviction. Be homeless or about to become homeless, and they did not cause their emergency to have the capacity to plan for it. Okay, so I am from that unit, and I can, we do not give them money. We work with vouchers. So to avoid homelessness, we will try to place a person in a shelter. We work with many shelters throughout our county and other counties. We usually resource or use other shelters in different counties when our shelters in Union County are packed, are full. And that happens a lot during cold blues when the temperature drops 32 degrees or under. But usually we try to keep our clients around the area. Unfortunately, nowadays it's a little is hard because of everything being packed, and some of the shelters that we work with, some of them also have their own funding, so they also place some people that come through their own door, and that limits the amount of beds that we can work with. So that's why sometimes we have to outsource to other counties, even motels, because we also work with motels. But and another thing is that there is there is already something established between certain motels and the agencies. We just don't send people to any hotel or motel. They have to be able to work with us under the regulations that the state has set up for us. Okay. So I think someone was asking me about how much is the EA. Unfortunately, like, there's no set amount. It is if a person needs to be placed in a shelter, we will call the shelter to see the shelter that we have already established, to see how much it will cost us to put a person or a family in that shelter, and we will go with that. We have certain amounts that we can work with, so there's no specific amount, because it really depends on the situation of the person or the family and how long the stay will be in that place. That's why, unfortunately, I cannot give a specific number. Mm-hmm. Now, the time limit, that is very important, because let's say that a person was getting, I don't know, 6 months in Essex County, and then they move here, and then they're homeless here. We're going to try to, not overpass the 12 months, but we're going to count those 6 months that they use emergency assistance somewhere else. And also, another thing that I said is, and it's very important, because I have had clients that come from PA. They come here saying, oh, I was homeless in PA, and then I just moved to New Jersey, so now I'm homeless here. Most of the times, I will have to deny that case and go to a fair hearing. A fair hearing means that we go in front of the judge, the state judge, because if a person is homeless in a different state, county, or city, not within Union County, and they come to Union County, that's not really permissible, in the sense that if you're homeless there, that's what you got to get, that assistance. You cannot plan, because it's not like you're renting. If you were renting using your own money, that's fine. But if you're gonna establish homelessness in one state or in one county, that's what you gotta try to do all your paperwork before coming into Union County. That happens a lot. I've been through fair hearings a lot, when a lot of people come, oh, but I was living here and I moved here, now I wanna emergency assistance here. But you can't, because you were homeless in your previous address. So why did you move to New Jersey, being that you're homeless in, I don't know, New York? So you need to go back, and then they can get penalized for doing that. So if you become homeless in your county, that's where you got to look for that assistance. You cannot come to Union County pretending that we're going to help you because you became homeless in Essex County, per se. Again, now going back to, we do in emergency assistance, we do the TRA, which everybody comes and says, oh, can I apply for TRA? There's no such application as a TRA application, temporary rental assistance. There's no application. The application is an emergency assistance, and we determine, when we sit with the client, the workers, we sit with the clients and we determine how are we going to help you, whether it's going to be shelter placement, whether it's going to be temporary rental assistance, whether it's going to be back rent, whether it's going to be paying your back utilities, or paying moving expenses, paying for your storage. We're going to sit with you, and we're going to listen to what happened, why you came down to this instance that you now are in an emergency assistance. Another thing is that people come and say, oh, I'm gonna be evicted, I don't know, next month. So then that's not an emergency. So most likely I could take an application, but I'm not gonna do anything for you because you're not in that emergency today. Emergency assistance is when you are in emergency, the day off. So if you come to our agency saying you're going to need help because you're going to be evicted in the future, unfortunately, I'll take an application, I'll listen to the problem, but first of all, I got to find out why is it that you becoming homeless in a month. So you have a month to work with, maybe getting a job, trying to pay for your rent, or trying to see what is it that needs to be done for you not to be evicted. So pretty much, I believe most of the workers do the same thing. We sit and we listen to our clients to see what was the root of the emergency that you're on today, the day that we're seeing you. Now, the only downside to this is, like I said, and I mentioned it before, you need to be receiving cash assistance from our office. So in order for emergency assistance to be received by a recipient, you need to have applied for cash assistance in the form of GA or in the form of TANF, and that cash needs to be open in order for us to assist you. If you do not receive cash assistance from our office, we're not going to be able to assist in any way. Now, also, we will consider SSI recipients. If a person is receiving SSI, we will see the case. And if they're receiving a combination of SSI and SSD, we will also, attend to the needs of that person. But people that receive Social Security benefits only, they're not going to be eligible for emergency assistance. Unfortunately, that's part of our regulations.
Couple questions for you.
Yes.
When you sit with a client and they're requesting emergency assistance, who decides if they go to a shelter or if they get to have TRA or anything like that? Is that up to your office, or how is the problem solving done?
So it's pretty much up to us. We will review the case first, and we will kind of see why is it that we should provide you with TRA.
Okay.
Because I remember, even if we give you TRA, it's going to be TRA is emergency assistance, right? Emergency assistance is only good for 12 months throughout your life. So if you don't have a plan to become self-sufficient, even if we give you TRA, in 12 months, if you have not figured out what to do, you're still going to be homeless. So that's when the question comes, and we work together with the client, and I pretty much, provide them. We start with a work search, a housing search in case it transitions from a shelter to TRA, because I used to do that a lot. I used to transition from shelter to TRA, from TRA to security deposit. Because if I'm working with a client trying to make them be self-sufficient, I want them to start either looking for a job, or if they don't have the skills, trying to get those skills through one stop, trying to get them, kind of I always tell them, be realistic and see what's your plan, and see where is it that you want to go. Because I'm very upfront with my clients, and I always tell them, you only have EA for 12 months. Once 12 months comes, chances are, if you're an able body, you're going to get denied for emergency assistance. And I'm not just talking about shelter, but TRA. So I don't want to see my clients losing an apartment at the end of 12 months. So I always tell them, well, the plan should be either get some type of a skill or get some type of job to try to become self-sufficient. So a lot of my clients do understand, and we do try to work together to get to accomplish something in their life. And I have experiences where my clients, first thing they want to do is, okay, I want to get a job so I can get off this, because I always say, God forbid, in the long run, as you become a senior, you do need it, especially when you're like on Social Security benefits. And we know nowadays Social Security is not enough. So God forbid that you fall into a hardship and you need emergency assistance. And then back in the days when you were a lot younger, you used it all. So what's going to happen when you're like all, you are already a senior, and then you have no emergency assistance anymore. That law has not changed yet, that they're going to change that 12 months. So we don't know what's going to happen in the future.
And then I had a question about the shelter system.
Yes.
You know that a lot of shelters are like men only, women only, families only. How does that work as far as trying to keep families intact?
So usually, like we work with motels. So when we, here in Union County, we use the YMCA for families. We use the Salvation Army for single adults, whether female or male. And then to keep them together, if the shelters are packed with families, we try to go and put them in motels together.
Okay.
Yeah. And again, just, you know, just going back, I think it was Ali from legal. She was asking how much we give. We don't give them money, we give them vouchers. We call them vouchers. They're pieces of papers. It has an amount of how much we're going to pay. We give vouchers for whether it is to pay for what do you call it, for a shelter. If it is TRA, we're still going to do a voucher. If it is back rent, we're still going to do a voucher, but it really depends. Now, the only thing that I can put my 2 cents into this is if I'm working with somebody that owes back rent, I am going to obviously study the case and check if are they going to be able to continue paying their future rent. Because honestly, I'm not going to pay back rent of a person that cannot afford a rent going forward. So meaning like, let's say that a person is making, I don't know, $1,000 a month and the rent is 1,500 and then they already 3 months. Honestly, I'm going to hesitate to pay back rent in that case, because if I know that the income is less than the rent, I'm not going to pay something that, you know, I'm not going to help. I'm not going to assist on how this person is going to pay back rent, because they're not going to be able to afford the rent going forward. But I will help in the sense that, listen, why don't you move to a different apartment where you can afford the rent that you have to pay? Because there's no point on paying a back rent where you're not going to be able to afford the rent. So I try to kind of, you know, talk to them and make them realize that going forward, you know, the rent that they're expecting to pay, they're not going to be able to afford. So why would I pay something that is already owed? And the same thing goes for utilities. We do utility assistance, back utility when they owe utility, to get them up to date. And we, right away, I tell them, okay, if you cannot afford your utility because you're low income, then you need to apply. We connect them with Proceed or Hopes, and they need to apply for some type of assistance so they can get assistance for the utility payments. But we do also do vouchers for that. In regards to transportation, if we see that the transportation is mainly for those that have probably like a disability, they're getting SSI, and they need some type of transportation to get to, I don't know, to their doctor, we probably will do it. Also, if they need to, something to do with like work search, we will help them with vouchers to try to get some type of uniform or something that they need. As far as furniture, a lot of people have asked me also, how about furniture? Well, I need a bed. Yeah, but unfortunately, we cannot give vouchers for beds, because otherwise we will have a line down the block looking for everybody to get vouchers for furniture. So we do, in the case that there is natural disaster or like infestation of some type of bed bugs per se. But before we even do those vouchers, we will request verification that those apartments or that apartment was treated at least 3 times. You know, and we ask the landlord or whoever to bring us verification. So we will verify. And that goes for furniture. And there's also other organizations that provide some type of assistance as far as furniture. There used to be furnishing, I haven't used them in a while, but there
There's
was this
Furniture Assist
organization.
in Springfield.
That's it.
Yeah.
Yes. So, you know, there are organizations out there. Unfortunately, a lot of the times we have to turn our backs to many of our members of the community because they're not eligible for whatever reasons or situations that they fall in, but we're always ready to refer them to certain organizations that I have mentioned throughout this presentation.
And then is it still the same regulation that you only would pay up to 3 months back rent?
Yes, that hasn't changed.
Yeah. Okay.
Yeah. Any questions? No? Okay. So as I'm pretty sure you're all familiar, the 211 came along. So that's when we cannot assist. We ask them that they call the 211 number or the 1-877-652-1148, which is also the same as 211. It is open 24 hours a day, 7 days a week. And they also are there to, you know, provide you guys with any organizations, information, and things like that. So that's what it's there. When we're closed, we always tell people, please call 211 so they can either be placed sometimes when there's an emergency and a person needs to be placed during the weekend and we're closed, they can always call 211 for that shelter placement.
Do they do placement or just referrals?
They do placement. My understanding is that they do placement. At least they could place you during the weekend. But if it is during the week, they will place you at least one night. But then they ask you to come back to the Board of Social Services the following day. Yep.
Okay.
Applying for benefits. So the SNAP applications can be nowadays can be completed on after the pandemic. We have to all kind of go online for everything. So you can do it using your computer, a smartphone, or a tablet. Senior citizens and disabled patrons can always request a telephone interview, and if they're unavailable to come to our office. So I always tell them call this is our main number, the 908-965-2700. They can call this number for any questions, or if they're seniors and, like I said, not disabled, they can always request a telephone interview. For the Workforce New Jersey, TANF for GA, which is the cash assistance or the emergency assistance, those applications are completed with a face-to-face interview. So for that, they will have to come to the office. The cash assistance applications can be started online. They can go and create an account online through mynjhelps.org. But at the end of the day, they will still have to come to our office because there's going to be a lot going on with an interview. Most of the forms can also be nowadays uploaded into the online site that they're going to create their account. They can always put it in there. New Jersey Family Care applications can be also completed online, or the client can pick up a paper application, which we have them at the reception area here in Elizabeth. Also, I believe they also have it in the Plainfield office. And they can always either fax or mail the application back to us. And also in every office now, such as Elizabeth and Plainfield, there are mailboxes in the front where the persons can just go and drop their kind of an envelope or, you know, their application. As long as they put their name and case number, they can always just drop off information for us or verifications.
Question for you about translation availability. Yes. If it's a phone interview, do you have a translation line for other
Yes,
languages?
we do. We have translation lines set up. Nowadays, we have in the office people that can speak Creole and Spanish. But for other languages, we use the translation line, yes. Swahili is one of the, oh my God. Many of my clients were with the language of Swahili, and yes, we have the translation line. It was a blessing.
Yeah.
Yes.
And that's for in-person and phone interviews?
In-person and phone interviews, correct.
Thank you.
Okay, so processing timeline, the clients applied for SNAP, TANF, VA, Medicaid. The Workforce New Jersey client is referred to see a work specialist. So usually to all this, the processing line is usually 30 days. We're hoping, I'm going to be honest, like over maybe like a month ago, we were very backed up. At the beginning of the year, almost we had a 200% of an application that is backed up. So we were very busy. But and we were backed up to I believe it was like the most that we've been last year. It was like almost 5 months, 6 months. But thank God, because there's been overtime. The director saw that we had to process applications. There's been a lot of work under the weekends. So nowadays it's almost getting to be current, like 30 days. So, but we're still, some applications are still delayed sometimes because there is verification missing. There is the back and forth between the client and the worker. Sometimes the clients do not submit the right verification, so we try to call them. Sometimes their telephone is not working, and then we try to send them like a mail, correspondence. And if they don't have their name on the mailbox, then that mail is just going around. Sometimes they don't have the right address. I always ask, as organizations that I do presentations, I always tell them, please, the first thing that you got to let your clients know is please always update your address, your telephone numbers, because if we need to contact you, those are the only two ways that we're going to try, either by phone or by correspondence. And if you don't have your name on the mailbox, that probably that correspondence is going to come back to us. And then when something comes back to us, we will hold it. But at the end of the certain time, we're going to deny it. We're going to end up terminating that case. So if clients come back to us saying, oh, my case is closed, it's probably because we couldn't reach you. So at some point, we have to terminate the case. And then that's when we get clients coming in here, oh, but why did you terminate? Like, because we don't have a phone, a current phone number, and we don't have the proper address.
Mhm.
So, but yeah.
And if they have an
usually...
open case, I'm sorry.
No, go ahead.
Oh, if they have an open case and they don't reply to a phone interview or some other request for correspondence, is that cause for sanction then?
Yes, it closes for a sanction. Yes.
Okay.
And a termination of their case eventually.
And a termination. Yes. Okay.
And this is just general information. Agency hours, we're open from 8 to 4. On a case of an emergency assistance, which has to do with eviction or any type of emergency assistance, we ask them that they come early during the day, especially if it has to do with some type of housing problem. Do not wait until 12 or 1 or 3, because if we have to place someone in a shelter or a motel, it takes time for us to kind of locate a bed available. Remember, sometimes the shelters don't have beds available, so that means that we have to call other places around. And that's why sometimes at the end of the day, we're sending people far as Ramsey. I have made deliveries of food during the pandemic to Ramsey, to Parsippany. So that's how far we will go to place people sometimes when something around here is closed. And to be honest, like the people that have an emergency, they're not going to wait until 4 o'clock. If you have an emergency, you're going to see them in our front door at 8 a.m. trying to figure out what to do before the end of the day. So
I have a
yes.
quick question. So is the Dropbox in the lobby, is the lobby door open all the time, or you have to use the Dropbox during regular business hours?
Business hours, during regular business hours. And we have officers sometimes because, at the entrance, their offices, you have to go through to the x-ray machine. So what they can do is sometimes even the officers receive the the mail and they themselves put it in the box.
Okay.
Yeah.
And one more thing, what is better? I'm helping someone with some Medicaid papers on Monday, and I think she's late. Is it better to do it online or better to put it in the Dropbox? Paper or online?
Well, I will say online is better because you can create an account and upload those documents. So I think doing it online will be better.
Mm-hmm.
Okay.
And then if people are placed in a shelter and it's far away from the office, is there transportation available? And then I'm assuming that they have to come back for an appointment to follow up. Is there transportation back to the office?
Yes. So when we place people or families far away from our office, we do give them transportation tickets that they can either go back and forth with the bus. Yes. Especially if we're working with them, we know that we have to provide it to them because, if they're there, it's probably because they don't have any cash. So we have to make it available to them. Yes. We have a transportation unit. Yes.
Okay.
Okay, so implemented, this is what was new for every client to do everything online and to upload documents is the www.mynjhelps.gov. And if a client is seeking recertification and they want to email verifications, only for them is the elise.readetbank@ucnj.org. But this is only for clients that already have cases going on. And we always ask them to put the case number or their name, clear with the case number so the worker that checks can know where they're going to send those certifications through email.
How often do people have to recertify?
It's usually every 6 months, but for seniors, they usually do it from 1 year to 24 months.
Ivana,
Yes, Charles.
the standard is 12 months. If somebody has no income or they're homeless, we obviously want to see them every 6 months, just because so many things can change.
Yes.
But the standard is 12 months. Seniors on a fixed income such as Social Security, we usually do them for 24 months with,
24, yeah.
and then for every recertification, 6, 12, and 24, at the halfway point, we mail them a document asking if there's been any changes. They have to sign it and mail it back to us to continue their benefits.
Okay, so that's not a full re-verification, but every 3 months you have to say,
Yeah.
Are there any changes?
Right, like 3 months on a 6 month cert, a 6 months on a 12 month, and 12 months on a 24. Just
Okay.
asking. It's a very basic form. Basically you just go no, 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 and sign it, and then they're good to go for the rest of the cert period.
Okay.
Thank you, Charles. Okay, and also another I always like to refer to this handbook. This is a different handbook from the one that I mentioned at the beginning, the verifications. This handbook contains information about all the benefits that I talked about during this presentation. You guys are welcome to go into the link and just download it. It's not too many pages. I used to have like the actual book, but I think the state doesn't want to print it anymore. So they want us to just share the link so people can just go and, download it as they need it. But you will find in this handbook all the benefits that I talked about.
We actually had an intern download this PDF and create a Word document so we could hand it out. And it's so so just for everybody on the call that needs a physical handout, it's not in the pretty pictures that they have in the handbook, but it is available in hard copy.
Yes.
Through RAP. Okay.
And again, I just mentioned this before about the Family Care Cover All Kids program. It hasn't changed. It's just what we need. If you see a letter closer, is what we request when people apply for the family care. Is we need identification, social security numbers, date of birth. That pretty much goes into the application and what they can provide with the application should they submit it. But again, the Cover All Kids, it's for 19 and under, and they don't have to have a legal status. Here in Union County, the county Department of Human Services created what is called the action line. So that's what I put it down here. In case you guys have any questions, any questions that you guys concerning referrals, resources, you can always give them a call. The action line.
Excellent.
And this is only to show the county boards throughout the New Jersey state. Those are the main numbers. That hasn't changed either. So.
And this is to the Division of Social Services for each.
Right, Division of Social Service for each county, correct.
Okay, good.
And here's Mr. Dominguez information. He's the assistant administrator for my unit, the community engagement, and my name and my information. I was explaining before when I was talking about health insurance, if you are ineligible for New Jersey Family Care, remember everybody calls it Medicaid. So if you're ineligible for Medicaid, they might want to take a look into get cover New Jersey, and the organization that I know for a fact that helps a lot with those applications is New Jersey Citizen Action, and they also have a number there. So anyone that has a social security number issued by the Social Security Administration, and they do not have a legal status, but they're working, they're in the process of, they have a work permit, they have a TPS, they can always contact them, get cover New Jersey. And that's it.
Any additional questions?
Yes.
Giovanna, I'm sorry. I don't know if you mentioned, but something new that popped up on my NJ Helps within the past month is you can complete an application for childcare on there as well. So not only can you apply for SNAP, TANF, GA, Medicaid online, you can also submit an application for childcare through the state of New Jersey.
Okay.
That's excellent.
That just went live a few
yeah.
weeks ago.
Okay. So no, I haven't talked about that. But the childcare is not connected to us. They could do an application and it will probably go to 4Cs, right, Charles?
Yes, it does go to
okay.
the 4Cs, yes.
Okay, 4Cs. It's part of 4Cs, yes.
Any other questions? Okay, I want to thank you, Yvonne Ramirez and Charles Dominguez, for your attention and your time today. It's been very, very knowledgeable, help us be knowledgeable about the process. And I just want to thank you for taking the time with us today, because it's going to be very, very helpful for our clients.
Thank you.
Thank you.
Thank you, Jill.
Thank you so much.
Thank
Thank
you.
you,
And
guys.
if you guys have any questions, just send us an email, and we will take some time to answer it, but we will answer it. So you're welcome to just reach out to us.
Hey, thanks so much.
Thanks again.
Thank
Thank you.
you.
Have a good weekend. Thank you.